So today we are going to cover about the tongue, right. So before we begin with the tongue, we have a basic idea of tongue that like it's a sense organ, one of the special sense is included in this particular organ, which is the taste. And apart from that particular being a special sense organ, this particular tongue helps in like other functions like mastication, chewing foods, articulations of the voice, and as well as like moving of the food particles, etc., when we are chewing the foods. Now, if you are going to learn this particular microanatomy of this particular tongue, whenever you are going to see this, analyze the composition which makes this particular organ itself, it's made of some muscles because it needs some kind of movement. As you can see that it's continuously keeps on moving. So it is moving in a tremendous manner. So it has a dense muscle network in it. So it has tons of muscle inside. And these muscles are kind of two form of muscles we know so far. We can move some muscles and we cannot move some muscles on our own. We call them a skeletal muscle or voluntary muscles, and other muscles we call them as involuntary or non-skeletal muscles. So this muscles which is present in this organ or viscera is a skeletal type of muscle, but this is a kind of like muscle which has got different directions. Some of the muscles are transversely directed, we call them as transverse fibers. Some of them are vertically directed, we call them as vertical fibers. Some of them are in between them, we call them as obliquely directed. So they have different ways of fibers directed present in the tongue and helps us to move the tongue in different directions. Like it has a round out 360-degree movement inside the oral cavity because of having so different types of directed muscle fibers there, and they are really strong. And we can bend it, fold it, unfold it, we can move it, throw it out, pull it in, anything we can see. And even primate element, you can see that the tongue has got like attachments. Our attachment of the tongue is on the back side. In case of the primates, we see the tongue is attached to the tip of the teeth, and they can throw the tongue outside as well, just like frogs, etc., etc. Now, as we are going to talk about the tongue, we are having this particular muscles, and beside this muscle we have some kind of layers which is covering these things, and that is known as the mucous layer. And this particular mucous layer which is holding this particular tongue and present with some kind of glands, and this particular glands is having some kind of cells, we call them as epithelial cells, that we understand this particular region, and epithelial cells resting on a platform, we call them as lamina propria, and this particular lamina propria and this epithelium is tightly placed, so that under to this muscle we do not have much space there. So this particular upper mucous layer, which is made of like epithelium, is tightly stitched with the muscles inside. So we do not have much of space, so that the mucosa of the tongue is not slipping on the muscles underneath. So they are kind of like a very densely adherent structures. So these are the basic things, and now we dig in deep about these particular layers as we are moving down. But before that, we have to understand the shape of the tongue. It is kind of a conical shape. It has two parts, we call them as oral part and the pharyngeal part. Front part, which you can see, is a oral part, and part which is layered back, which is anchored, we call them as pharyngeal part, because they are deep inside the pharynx. And the pharyngeal part is adherent, and this oral part is free in the anterior side and as well as on the lateral side. It has a tip pointed part, and it has a margin which is lateral side, which is free. We can just like move the tongue up and down. Under to the tongue, we have this particular mucosa which is resting on this particular region, we call them as buccal cavity, or also known as floor of mouth, which is the tongue is resting on. So we have the floor of the mouth, this is roof of the mouth, and this is floor of the mouth, right? If you see that as a chamber inside the oral cavity, it has a roof and a floor. So the tongue is placed on the floor, and if you move the tongue out, you can see that under to the tongue we have this mucosa, and on the side of the mucosa we have some kind of pores opening for the salivary gland. We have the gland, we call them as sublingual gland, we learned yesterday or before that, which is a salivary gland below the linguae, that means tongue, that opens in that particular floor of the mouth on the mucosal folds. And this particular tongue has got two surfaces, one is ventral surface, other is dorsal surface. Two surfaces is there, upper surface, lower surface. So this ventral and dorsal surface is there, and this tongue is divided into two parts by a midline slit, we call them as foramen caecum. So inside the middle of the tongue, if you just like take your tongue out, throw some light and see on mirror, you will see that there is a central part which has a central slit, which is a midline slit, we call them as foramen caecum. So that foramen caecum is that like the flag which divides the tongue into anterior and posterior, the anterior 2/3 and posterior 1/3. And from the foramen caecum, if you just like draw a straight line, which kind of like a V-shaped straight line from the foramen caecum, we call them as lamina terminalis. So, which is splitting the anterior 2/3 of the tongue and posterior 1/3 of the tongue. And then we have this particular tongue which has got like a mucosal coating. The mucosal coating, that means it has a epithelium and lamina propria, that means the cells which is present inside to it. Now, the feature which makes this particular tongue different than that of rest of this mucosa is that the mucosa of the tongue are thrown into folds. They are not flat, they are wavy. So, this particular waviness of this particular tongue mucosa, we call them as papilla. We call them as papilla. So, this particular mucosa is not a straight one, not a flat plateau. It is not like, it is kind of wavy. So, it is kind of like a habit waves and up, beats and up like that way. So, we call these elevations and depression as papilla. These are bumps. Now, these papillas are of different shape and size. So, they are of 3 different types, shape and size. We categorize and classify them. How do they look like? So, what we are talking about? The bumps. What are the bumps? The mucosa. What is mucosa? The superior layer of the tongue, which you can touch, feel. So, this particular superior mucosa is not a straight thing. It is having bumps. Those bumps we call them as papilla. Papillas are of different shapes. That not all the bumps are of same size and shape. They are something like something skinny, some part is flat, some part is like a bulbous, like that. So, they have different names because of they look differently. Now, within this particular papillas or these particular bumps, some of them hold some kind of special organs. That special organ we call them as test bud. We call them as test buds. So, these are the things which makes this particular organ special for us to identify that this is this and identify accordingly. So, this elevation and depression within this some special feature which makes this particular tongue special and separates it out from rest of the mucosa. Clear? So, this thing what we have to keep in mind. Just like yesterday or the day before, we learned about that salivary gland, and we learned about salivary gland is an exocrine gland. An exocrine gland has ducts, but the ducts are numerous in case of the salivary gland compared to the other glands. So, as we are going to see the pancreas, etc., etc., we are going to see some ducts there as well. But in case of this salivary gland, the ducts were plenty. You have seen that, like everywhere it is duct, and along with the acinine secretory part is there, and they are separated with the lobes. So, here in case of this particular tongue, it has bumps that we are going to identify. That bumps are like mucosal folds, waves. Mucosa means cells plus lamina propria, and these particular cells are layered in not a single layer. They have stacks, multiple layers, 1, 2, 3, 4, like multi-storied buildings. So, multi-storied cells stacked there. What kind of cells? We are going to learn. So, these particular within this particular cells, the mucosa have a shape. What kind of shape? Wavy shapes. That wavy shapes we call them as papillas, and papillas are not same. Some of them have different shapes and size. We are going to learn them, and within some of these papillas, they are having another special feature is that they have the test bars in it on the margins of it. This particular test bars, they look like onions. So, if you see the onions in slit, they look like peels of the onion, skin of the onions like this. They look like that, the onion skills. Whenever you are going to see that, it will be like a dark stain, and this particular test bars stays out of the stain, and it is a light stain. They will be like looking like onion, small onion cut slit piece and placed on it, and they are little bit less stained. They will be not refusing to take that all the stains that we are throwing. So, it will be dark stained and less stained areas of the white spots or patches are there resembling like onions. And you say that sir, I cannot see onions, but I cannot show you onions all the time, but they look like, because you know people imagine like that, they look like that. It is not about that the exact same thing you are going to see, but it is like that. So, if you look at a cloud, it looks like this, you say that it looks like this, not like exact thing, it looks like plane, or it looks like some kind of like a object or elephant or something like that. It is not the real thing, but they look like, resemble. So, they look like cut onions, small onion pieces there, and they have a particular shape. They have a central part, we call them a gustatory port. They have this particular neuroepithelium anchored to it. The taste is picked up by these particular receptors, they are present in it and chemically analyzed and sent back to the neural system through the brain and analyze that this is bitter, this is sweet, this is blah blah blah, right. So, this is about the basic thing about this particular tongue. So, what we are going to learn here, not those complex stories. What you are going to learn about tongue is a muscular organ. Beside muscle, we are going to see the layers of mucosa. What do you mean by the mucosa? It is wrapping around this particular muscles of the tongue with some kind of cells plus lamina propria. Now, as this particular mucosal layers are there, they are having multi-layer cells. Now, how these particular multi-layer cells are present in here? They are of different elevations and depressions. We call these as a papillas. Now, these papillars are of different size and shape. We call accordingly about this particular papillas. Within these papillas, we have this taste parts. Not all of them, some of them are having these things. Alright. So, this is what we are going to see. So, this is the theoretical part that we are going to talk. Let us quickly go through this particular things as you are going to learn here, and then we can go and see the slides and identify this. So, this is what we talk about, the gross features of the tongue. We already have understood that this particular tongue is looking like this. So, having this particular central slit, we call them as fovea centralis. Then we have this particular foramen caecum, this slit we are talking about. Posterior to that, we call them as pharyngeal part of the tongue. Anterior to that, we call them as oral part of the tongue. The tip is this one is a lateral margin, right. This surface, there is a under surface. This is a superior surface, the ventral surface, and under to it we have the dorsal surface. Apart from this particular like a dots that you are seeing here, these are the bumps that we are calling about. So, they are microsectionally looks like different. Apart from that, we have some kind of collections of the lymph nodes, they may be present. If they have lymph nodes present in care, we call them as lingual tonsils. They are lymph nodes, collections of the lymph nodes which are present to it. So, this is like a general feature of that, and this part of the tongue is anchored. So, this is the pharyngeal part, this is the oral part of the tongue. This is general feature. So, which is not a part of concern to us. Concerning to us is that what this particular tongue is made of. So, made of these particular muscles, and this particular muscles, on top of that we have the very tight lamina propria, and on top of that we have this particular epithelium cells. Now, epithelium cells which are present in here, we call them as mucosa, right. The mucosa is composed of epithelium cells. They are of stratified squamous epithelium. That means they are multi-layered and they are scaly cells, they are present on top of this. So, one after another is there, and this particular stratified squamous epithelium are not keratinized. Like in case of skin, this stratified squamous epithelium has a layer of keratin. So, we call them as keratinized. This one we call them as non-keratinized stratified squamous, because these are mucosal. Now, if we have too much of friction, if we have tongue undergoing changes like cancerous changes or etc., it may show some kind of abnormalities. The keratinization may appear. So, then we call them as that the tongue is having some sort of trouble transforming. So, it is chancing of getting from good to bad or good to bad diseases, we can identify it. So, this is how the microanatomy of this helps, which clubbing together with the pathology, as we are going to learn in the future classes, there will be changes from the normal to abnormal things. Then you can understand that this is diseases and this is having trouble with, understand. So, this is the normal thing. So, we have these muscles. Under to these particular muscles, we have this particular epithelium like mucosal lining. A mucosal lining is made of this stratified squamous epithelium and lamina propria, and in between them we have a very tight layer, we call them a submucosal coat, which holds some kind of glands, but they are very tightly knit structures. Apart from that, what we are saying here, the dorsal surface is having this particular part and having this particular part with these particular elevations on there. Now, these particular elevations we call them as papilla. So, these papillas present in the tongue, we call them as lingual papilla. So, these papillas are of different size and shapes. That mucosal bumps are there of different size and shape. If they look like conical, we call them as filiform. This is the most numerous form. They look like cones, we call them as filiform papilla. then they have this particular look like fungus, we call them as fungiform, and they have a truncated fungus, we call them as circumvallate papillae. So, these 1, 2 and 3 forms of this particular mucosal bumps, they are plentifully found. Now, this particular filiform, which are plentifully seen in case of the tongue, they are like not having any kind of taste buds in it. So, we are not going to see any taste buds on it. So, they are like this only. So, they are filling these things. What they are making of? They are making some friction surface. That means they are holding this particular food material, they are holding some kind of element, so that whenever you are grinding the food is not slipping away from mouth. So, they are holding this, giving some resistance. So, if this particular thing becomes flat, we call them as flat tongue. In case of some of the diseases, the tongue becomes raw. This Filiform Papillae, we lose that. So, that then the patient loses the taste and cannot eat the food properly, because their grinding part is over, cannot hold the food material long. So, they have a trouble in chewing, taking foods, loss of appetite, things are there, right. So, then we have this particular fungiform and circumvallate papillae. They look like fungus, like bulbous things, like mushroom. So, they are known as fungiform papillae. And this particular circumvallate, they are having a same look, but is truncated, flatter, and they have slits on the lateral margins. So, in between them 1 and 2, and in between these things are there, and they have a slit in between, which is narrow slit, and you can see that within this particular margins of this particular elevations, we have this particular spots like this. You see that? Let's stain point, let's stain taking parts 1, 2, 3, 1, 2, 3, 4 like this. So, these are taste buds that we are referring here. So, these taste buds are present in the fungiform papillae and circumvallate papillae. Other papillae, they are near there, you call them as foliate papillae. They are present in the carnivorous, like dogs, cats, they are plentifully seen. In human, we do not see this particular foliate papillae much. There, but not very prominent. Okay. So, this 1, 2 and 3 we human are having with plentifully present, and this particular out of 3, number 2 and number 3 having this taste buds in it. So, we are going to identify them and going to identify these papillae, and once you identify them, if you identify number 2 and number 3, we should be looking for these taste buds, and number 1 you should be appreciating no taste buds are there, you will be seeing that no taste buds. Number 2 and number 3 will be having this. So, this is about the general feature. Filiform, fungiform, circumvallate and foliate is there, vertical lines are there, on the margins or the lateral margins of the tongue they are present, but not very plentifully formed. So, 1, 2 and 3 is the thing point of concern, spiky end, mushroom end and a truncated end of this mucosal elevation, we call them as papilla, and mucosal elevation, that means cells plus lamina propria. Cells means stratified, squamous, epithelium. What do you mean by stratified, squamous, epithelium? Layers, more than 2 or 3 layers will be there. How do the cell look like? Squamous means flat kind of cells. Clear? Good. Now, this is how this thing should be looking like. So, looking at this particular picture, can you figure out the difference between these papillae, picture 1 and picture 2? Picture 1 is filiform, cone shaped, sharp margins. Bottom down, we have this particular fungiform papillae, who look like fungus, right? And in this margin, slowly you can look at down at the search through them, you will be seeing and looking for these particular taste bars on the sides. There will be mix of things, not like this one is there only, then it will be all fungiforms there. In between this fungiform, filiform and circumvallate will be mixed and sparsely present and distributed accordingly, right? So, this is about this particular thing. Now, coming to this particular taste bars that we are referring. So, ideally schematically it should be looking like this, peel of the onions, cut piece of the things we are seeing here. So, ideally it will be looking like a circular or conical. They have a central pore, and this particular onion peels, they are present like this central pore, and under to it fitted with a wire. This particular wire is a nerve fiber, taking this particular chemical things which is going through this particular juices, getting in, analyzing and sending it to the higher centers to the brain through the nerve fibers, and analyzing in the brain what kind of taste they are, we are appreciating. Clear? So, this is the function of the taste, is a receptive organs, and that is what the tongue makes it as a spatial organ. That means we can appreciate this particular taste, that is why with this particular element we will have this. So, this particular like a taste buds have kind of cells, we call them supporting cells, sensory cells, basal cells, and this particular stem cells are there. So, these are the things which composing here. We have a central slit and we have a central nerve which is draining these things out to understand. Now, this how these things should be looking like, and now look at this particular picture and see that which one do you think is the test parts. So, they are present on the margins, they are present on the top. So, out here what you are seeing here, that elevations, what do you call these elevations, bumps? Papilla, and papillas are of 3 predominant different size, and out of these 3 types of papilla, which one holds this particular taste buds? Circumvallate, fungiform, 2 of them. Where exactly you are going to see? Margins. That means on the margins of it you are going to see. So, these things are elevations which you are seeing are mucosal elevation, that means they are cells there. So, these are the cells that you are seeing here, and this central part is the lamina propria, and this lamina propria is anchored down and up there. Down here we are going to see this particular submucosal small glands, and deep down we are going to see the muscles. What muscles? The muscles present in the tongue, skeletal muscle, which helps us to move this particular tongue, and this element is the mucosal element, which is looking kind of circumvallate or kind of like foliate things, and they are fitted with this particular taste buds which is taking the taste sensations. So, to summarize these things, we have this tongue having 2 basic components, mucosa on top of the skeletal muscle, which are plentifully differently directed fibers are there, clear, and this particular mucosa have got epithelium, and that means cells plus lamina propria. Under to it we have this particular glands which is present in small submucosa, that under the mucosa very thin skinny layer there, we call them a submucosa, but we do not have much space there, very tightly skinny. So, mucosa and the skeletal muscle is basically pasted one after another, and we have a very few areas of this particular glands existing under this particular papillas, and these particular papillas are of 3 shapes, predominantly filiform, fungiform, circumvallate, and this epithelium which is present is non-keratinized, stratified, squamous epithelium. So, this is the ideal network how this should be broadly looking like. The central part is filled up with these muscles, this part muscles, blood vessels, these are blood vessel muscles you are seeing here, right. These are margins, that means mucosa, and these mucosa are thrown into folds. So, these mucosa are folds are known as papillas. The papillas are of 3 types. They should be looking like this. Clear? So, you write down in short the layers you are going to see in the specimen that you are going to see. Second thing is that how is the epithelium like, that means epithelium consists of what kind of cells. Then we are going to see that what spatial feature mucosa has in the tongue. So, these basic 3 things you dig into your brain and try to recollect. Then you go to the slides, there are 5-6 slides are there, press there and try to see the things whatever we have discussed so far. First thing, what are the layers you are going to see on the tongue specimen. Second thing, what kind of epithelium you are going to see there, that means things, and what special feature is this mucosa having, that means so far whatever you did discuss. So, once you clarify these particular things on your mind, then you go and see the slides, split into groups and see the things whatever you are going to see, what you are expected to see. If you know, then you can see that makes these things clear for you.